Everyone. So this video is going to be about loop diuretics. Diuretics are drugs which increase the urine output, and by increasing the urine output they decrease the plasma volume and are used in condition having fluid overload like edema and hypertension. Loop diuretics are also known by name of high ceiling diuretics. High ceiling diuretics because these are most potent diuretics. And the name loop comes because they act on thick ascending limb of loop of Henle. So loop diuretics act at thick ascending limb of loop of Henle, so they are known as loop diuretics. Now they function by blocking a sodium potassium 2 chloride channel. This is the channel or the transport pump they act on. Let's try to understand physiology of this sodium potassium 2 chloride channel first. So this channel is located at thick ascending limb of loop of Henle. This is the magnified view. This is the lumen of the loop limb of the ascending limb, and this is a tubular epithelial cell, and here we have sodium potassium 2 chloride channel. In normal condition, this is the sodium and chloride which is filtered and reach the ascending limb, and it is transported via this pump into the cell easily, and then it goes into the systemic circulation. Around 25% of sodium and chloride are transported via this pathway into the systemic circulation, and this is so easy because sodium and chloride, both of them are extracellular ion. So these extracellular ion are easily transported intracellularly and then to the systemic circulation. But the problem comes with potassium. Why? Because potassium is an intracellular ion. Potassium is already present inside the cell. So whenever this pump pushes the potassium inside, potassium is itself pushed outside of the cell. This process happens again and again because already positively charged potassium is present inside. This pushing of potassium outside creates a negative charge around here, and this negative charge is going to attract two divalent cation that are reaching to the lumen. These are calcium and magnesium. So in toto, this sodium potassium 2 chloride channel is going to 25% absorption of sodium and chloride with no change in absorption of potassium, with absorption of calcium and magnesium. This is how this channel works. So now what happens when loop diuretics are given? When we give loop diuretics, it is going to block this channel, that is sodium potassium 2 chloride channel. So now no longer sodium chloride is going to be absorbed, so it will go into the DCT. Potassium was not getting absorbed, so it was also going to the DCT. Calcium and magnesium will no longer be absorbed because no negative charge is being formed, so they will also go into DCT. So this will result in hypocalcemia, hypomagnesemia, hypokalemia. But wait, no, sodium is not going to be excreted as such, because sodium along with water is going to be get absorbed in collecting duct. What happens in collecting duct, when sodium reaches here, we have cells with like sodium channels which is going to absorb sodium again. In this process of absorption of sodium, it creates depolarization here. This depolarization is going to activate proton pump and ROM-K channels. This proton pump is going to excrete hydrogen ions, and ROM-K channel is going to excrete potassium ions. So whenever there is sodium loss and this sodium being absorbed in the collecting duct, there will always be proton loss and potassium loss. So with this sodium absorption, we will have acidification of the urine, which will lead to metabolic alkalosis, and we will have hypokalemia. Also here, the point to be noted is that loop diuretics were used when for fluid overload and hypertension. This is because sodium and chloride is being also lost, though sodium is absorbed. Sodium and chloride is along with water is still being lost in urine. So this will not only decrease the osmolarity but also will result in decrease in BP. Okay. But wait, BP is decreased, but we have one more problem, that there is decrease in osmolarity. Actually, sodium chloride was maintaining medullary interstitial pressure, and this medullary interstitial pressure is what is maintaining counter current mechanism. But because of loss of this sodium chloride, there will be decreased osmolarity. Here comes compensatory mechanism in action. So this compensatory mechanism is going to do two things. Because of loss of the sodium and chloride and decreased osmolarity, urea is going to be reabsorbed. This urea reabsorption is going to maintain the osmolarity. And second thing is that one is urea osmolarity, and second is release of catecholamines. This release of catecholamines occur because there is sympathetic overactivity going to occur. The sympathetic overactivity will release catecholamine, and these catecholamine are going to act on adipocyte beta 3 receptor, and this adipocyte beta 3 receptor activation will lead to lipolysis and result in formation of lots of lipids, LDL, VLDL, and this is leading to dyslipidemia. So this is one of the side effects of loop diuretics, that is dyslipidemia. So this is what loop diuretics are actually doing. Let's summarize this fast. So loop diuretics are blocking the sodium potassium 2 chloride channel. Sodium chloride is not being absorbed. Potassium is also being lost, hypokalemia. Calcium and magnesium are not getting absorbed, hypocalcemia, hypomagnesemia. Along with which we have urea absorption occurring to maintain the osmolarity, that is going to result in hyperuricemia. Sodium is being absorbed in the collecting duct, but proton loss leads to acidification of urine and metabolic alkalosis. And we have potassium loss as was occurring before, leading to hypokalemia. Let's summarize this once again in a table. So loop diuretics are leading to metabolic alkalosis because of proton loss. We studied. Loop diuretics are causing hypokalemia. We studied about it. It is causing hypocalcemia. So because of one of the use of loop diuretics, because they cause hypocalcemia, is in malignancy where we have hypercalciuria or hypercalcemic condition, we can use loop diuretics to cause hypocalcemia. Hypomagnesemia is another feature of them. Hyperuricemia. This is the reason loop diuretics are going to worsen the gout condition, or they are going to inflate, they are going to cause the flaring of the acute gout. Hyperglycemia is a result of loop diuretics. This is because we have beta cells, and beta cells are hypokalemic. When beta cells are hypokalemic because of the loss of lot of potassium, the insulin is not going to be released from them. Because no insulin is getting released, we are going to have hyperglycemia. Ototoxicity is another feature, and this is a reversible ototoxicity that is seen with loop diuretics. This is because we have type 1 and type 2 hair cells that are present in the inner ear, and these type 1 type 2 hair cells also have sodium potassium 2 chloride channel. And when this sodium potassium 2 chloride channel in the hair cells is affected because of loop diuretics, we have a kind of reversible ototoxicity. Also, one of the important feature of loop diuretics is they are effective even when GFR is less than 40. So they are drugs, they are drug of choice when we have a GFR of less than 40, or in cases of renal failure or insufficiency. Loop diuretics are also drug of choice in case of pulmonary edema, or when a patient presents with hypertensive emergencies. Okay, drug of choice for pulmonary edema. Here the reason for decrease in the symptoms of pulmonary edema is not actually the feature of loop diuretic being it increases the urine output. The main feature here, loop diuretics being the drug of choice for pulmonary edema, is they also release prostaglandin, and these prostaglandin are going to cause vasodilation. Because of this vasodilation, there is increase in the release of prostaglandin, result in decreased preload, and this preload decrease is going to provide a very much relief in the congestion of the lungs, and will relieve a patient with CHF having pulmonary edema. We already studied it causes dyslipidemia. To know some names of the loop diuretics, one of them is furosemide, which is widely used. Okay, another one is torsemide. Torsemide is long acting and only one dose is required. These are the main drug which are loop diuretics. Like that.